Since 1972, CommuniCare Health Centers has committed to providing substance use treatment for Yolo County. JourneyHOME, formerly known as PNDT, has been providing intensive outpatient substance use treatment services for maternal caregivers with or without children in their care for over 4 decades. JourneyHOME's goal is to provide services that are holistic, strengths-based, respectful, and hopeful so participants leave treatment with sustainable recovery and strengthened families. To reach this goal, we invite each participant to be an active member in their treatment, defining their own goals for treatment and collaborating with their counselor on the steps to take to achieve these goals. The program is uniquely designed to reduce the barriers which have historically prevented maternal caregivers from accessing treatment by providing childcare and free transportation to and from treatment. JourneyHOME also addresses the specific needs of maternal caregivers in substance use treatment with a focus on healthy relationships and communication skills, addressing mental health symptoms and trauma, learning about childhood development, strengthening the effectiveness of parenting skills, and building strong recovery and parenting support systems. Entering substance use treatment is a courageous choice for any maternal caregiver, and JourneyHOME is here to support each participant in creating a new and healthy life for themselves and their family. As an intensive outpatient treatment program, JourneyHOME services take place every weekday, Monday through Friday, from 9 a.m. to 12:15 at our West Sacramento location, and free of cost transportation is offered for participants. Some of the topics and things we cover in JourneyHOME include interpersonal progress and insight groups, where participants process thoughts, feelings, challenges, and successes in a group format. Education groups, where participants learn about topics related to their addiction and recovery using several evidence-based, trauma-informed teaching tools. Skill development groups, where participants learn practice skills needed for sustained recovery, including relapse prevention techniques, refusal skills, assertive communication, stress management, grounding, and effective parenting. JourneyHOME uses 2 evidence-based teaching tools to help participants learn positive parenting practices during groups. JourneyHOME participants with children enrolled in the Child Development Program also receive one-on-one parenting coaching during playtimes. Maternal caregivers whose children are out of their care due to a child welfare case have the opportunity for their children to join them at JourneyHOME once they have stabilized in their recovery. JourneyHOME is proud to offer free child development classrooms licensed by the California Department of Education for the young children of participants. The classrooms are next to the JourneyHOME group and individual therapy rooms, allowing maternal caregivers to connect with their children during treatment. Every JourneyHOME participant has a therapist that does personalized, individualized therapy, treatment planning, case management, and program support with them. Individual therapy sessions are offered by a mental health therapist to each participant at least once per week. JourneyHOME participants are encouraged to invite their family members, spouses or partners, and other support persons to participate in JourneyHOME family groups or individual sessions to learn about the program, gain a deeper understanding of addiction and the process of recovery, and to share in treatment. Rebuilding and strengthening family relationships and support systems is an important part of recovery. JourneyHOME participants are offered free transportation with their children to and from program each day.
That was a part of my life that I didn't even want to live. And I feel like being able to come to a place where I was embraced and loved on and encouraged when I felt so ugly and so worthless and so not okay in my own skin. And I was able to come here and connect with other women who were, on their own path, but they were kind of having the same sorts of struggles. And being able to be seen and not be judged for, because everybody in my life at that time I felt was judge, jury, and executioner. And Journey Home was the one thing in my life that was not judge, jury, and executioner. They just loved me where I was at.
It's really like a deep question for me because it's really impacted. Going through inpatient was one thing, but when I came to outpatient here, it really helped balance my life. It really did. What it did is it showed me like a sense of responsibility. I got to be at home. I got to live on my as I wanted to on my own free will, and I wasn't being watched over constantly, and still being able to know that I had the outpatient, to fall back on. It was more than just like counseling classes, more than just gaining knowledge. It was like a sense of security for me, and it was like a big support. There were so many of us. I think it's impacted my life in ways that if I didn't have the outpatient, I probably wouldn't have succeeded the way I have. I really don't think I would have.
What I would tell a friend who is thinking about joining PNDT/JourneyHOME is go for it. It's an amazing program. The staff is amazing. You really pick up and get a lot out of it. It really does help you stay sober, deal with all those emotions you're going through and getting sober. And it's overall the best program I've ever been to. My favorite part was being able to interact with other mothers going through the same thing, being able to lean on each other through what we were going through. Having our kids there also helped. It was an amazing journey. It was an amazing experience. I did it for 8 months, and those were the best 8 months of my life because I really got a lot out of, PNDT/JourneyHOME, and I would do it again.
A few of our participants wrote, Journey Home helped me with a lot of issues. It's helped me restore my relationship with my kids and be independent. Journey Home helped me get where I am today. Just try it, give it a chance, let it work, because it will. And the best thing that can happen is that you can have the chance at a totally new life. Maternal caregivers that are interested in participating in Journey Home should first call CommuniCare's Behavioral Health Department and schedule a level of care access screening. During the screening, maternal caregivers should mention that they are interested in Journey Home. And if they qualify, they will be scheduled for an intake into the program.